I'll unmute and now speak. I have 1:15 straight up, so we will get going. I'm Chuck Carney, Director of Media Relations for Indiana University, and welcome again to our weekly news conference discussing all things COVID-19 with the City of Bloomington, Monroe County, Indiana University, and the Indiana University Health. Let's start, as always, with opening remarks. We'll go first to Mayor Hamilton.
Thanks very much. Welcome, everybody. Last Friday in April. Just some quick data points that I like to share. One is we had 3 employees test positive this week. As typically has been the case, there's no indications of being exposed at work and doing all the contact tracing that we should. That brings our monthly total to 7 for April, which is roughly double the rate of February and May each as a month, just to put that in perspective. I also will report that we've now had 282 employees who have filed for the $100 wellness benefit, demonstrating they've completed their vaccinations plus 2 weeks. So we're pleased to see that number continuing to go up, but we still want to see it continue to rise. That's critically important. An update I don't always give, but to let you know that the City of Bloomington Utilities is continuing its weekly sampling of the wastewater stream. We've talked about that at various times in the past year. They are continuing that sampling on their own. I would give you news if there's dramatic news, but as has been the case over the last month, it's really seen a very steady indication of the prevalence of the virus in the wastewater streams at our 2 wastewater plants, Butcher Pool and Dillman. For those who are scientists, they're seeing about 250 to 350 gene copies per 100 milliliters. That's kind of the level of viral gene copies, GENE gene copies that they're seeing, and that's been pretty steady for the month, just to let you know. Overall, and I know we'll hear that directly from our experts, the numbers are not, I would say, dramatically better or worse in terms of key indicators this week. Maybe we can take that as a victory in terms of hospitalizations and prevalence, positivity rate, and the number of positive cases. They're not dramatically indicating which way we're going yet, but let's maybe call that a victory for a week that it hasn't gotten significantly worse. Obviously, the continued vaccination is the key to this. Indiana is not in good shape on that. I think we're in the bottom tier of states in terms of how many people have been vaccinated. And I continue to be very concerned about the importance of making that progress week to week, month to month. And I know we'll hear about that. And thank everybody for how hard they're working. The incentives, the outreach continue to be important in my view. I'm not sure if Penny Cottle will be talking about a couple pop-up clinics coming up. I understand that the city and health department have been working on some that are Spanish focused, May 10th and June 7th for vaccination clinics. And then one on May 6th as well. That'll be at the Crestmont Boys and Girls Club to try to do some more of these outreach with vaccination clinics. So really appreciate all that people are doing. We have to keep our eye closely on the data and continue to please get those vaccinations, which is how we're going to get through this. Thanks. Back to you, Chuck.
Okay, let's next check in with the Monroe County Health Department and Penny Cottle.
Good afternoon. And yeah, I was just going to start with kind of where the mayor left off. We have 2 outreaches as we have sort of wrapped up our routine our routine vaccination clinic at the convention center. We will be there a little longer for some specialty things, but that as a regular clinic has closed, and we kind of funneling all of those appointments now to IU, to Sibley Hall. But we do have an upcoming outreach, as the mayor mentioned, at the Boys and Girls Club, and that is next week on May 6th. We have volunteers and staff who are going door to door this weekend to encourage people to come to that clinic to sign up so we can be prepared for a full time of vaccinations. And then I want to give a huge thank you to our community partners who are serving the Hispanic and Latinx community Our goal is certainly to provide information, answer questions, reduce barriers like language, and we have an outreach clinic that is planned. We've got more communication that will be coming out on that as well. And we could just not have done that without many of our partners in that community and service providers to that community. So we're excited. We think that may be the first of several. Certainly those are not, closed to just either one of those groups, but we want to do as much outreach as we can, knowing that some people have some barriers to getting into the clinics. And I'll talk more about that in a moment as well. But to talk about the vaccines, Johnson & Johnson is back in our rotation. And, we had talked earlier about the pause, but that has been assessed and is kind of back in rotation. So just want to remind everybody that that is proof that the adverse reaction reporting system that is in place works. That's what alerted officials to potential issues and gave them the ability to look at this very quickly and assess the information. So women younger than 50 should be aware of a slightly increased risk for rare but serious blood clotting disorder. And most people, and we've talked about this before, develop these blood clots and low levels of platelets. Most of them were females, 18 to 49 years of age. Their symptoms began 1 to 2 weeks after getting their vaccination with Johnson & Johnson. The chance of this occurring is extremely remote, less than 1 in a million, but we want people to be aware of this possibility, to watch for symptoms, especially if they are in this age group, but everyone should always be watching for symptoms. But seek medical attention right away if you have any of the following symptoms after receiving J&J vaccine. Severe persistent headaches or blurred vision, shortness of breath, chest pain, leg swelling, persistent abdominal pain, or easy bruising and tiny blood spots under the skin around the vaccination injection. Again, the risk of this is extremely low. These are safe and effective vaccines, each and every one of them. And we encourage people to make plans to get vaccinated. If you have your appointment, convince somebody to go with you. Take them with you, make it easy, buddy up and have an appointment, take a friend. The Indiana Department of Health is doing Family Day today at the Indianapolis Motor Speedway. And I think you can make any day a family day. Our vaccination site at both MedArts, but at IU Assembly Hall is Pfizer. If you are 16 and over, you are eligible to be vaccinated, and you can make it a family affair. I do want to share a little bit of information. I'm going to try to share my screen here as long as that works well. You can see that Indiana, well, maybe not perfect, and now I'm going to have to see where I'm going. My computer is not liking me, right? I said I was a little challenged on the technology side. So we have almost 1.9 million vaccines, people fully vaccinated in Indiana. You can look at the trends that are going on. There is a trending down of vaccine uptake. So we do, again, encourage people to continue to make those appointments. And then if you follow down, this is all on the vaccine dashboard, you can look at Monroe County. So fully vaccinated total count is 44,000, almost 45,000 individuals. And if you want to look at that by population, you can do that. And so you can see that over 35% of our eligible population has been fully vaccinated at this point. Again, not as high as we want it to be, but we are increasing those. This looks at the state. So you can look at the state dashboard, again, the number of vaccinations by age group, and you can see the people who've been eligible for vaccine the longest have the highest rates of vaccination. That's not surprising, but we also want to encourage all of these other age groups and anybody who has not been vaccinated that is eligible to get that vaccine. So I just wanted to kind of show people that in case they are not aware that that is an option for them. We're very pleased. We have over 47% of our eligible population that has received the first dose of vaccine. So again, vaccine is what's going to get us to the finish line on this. And we are assessing the data. The Board of Health meets next week. They've been meeting regularly to go over the data, to look at the regulations and make determinations on what changes can be made and when they can be made. The CDC has come out with new guidance on what fully vaccinated people can do. And if you haven't seen that, look at it, because again, you can kind of do more once you're vaccinated. That is a factor in deciding about regulations. Our cases per 100,000 is a deciding factor. What our hospitals are seeing is a deciding factor, as well as those positivity rates, what's happening around us, what kind of variants, all of that goes into these decisions. It is not just one number. So the slow change, while encouraging, it makes it a little more difficult to look very far ahead, but we do continue to do that. Our cases this week per 100,000 were 105. That was a decrease. We hope that that will continue. But again, you know, when I am here and I'm sharing that with you, my hope for next week is just that. It's always hope. Rides, I mentioned barriers earlier, and if you have an appointment and you need a ride, rides are available. If you need a ride to a state-sponsored site, so locally, again, I'm going to focus on IU and Assembly Hall, but you can know that that is a state site. If you go on the state's website for an appointment, it will say VAX or VAX after that location, and then you know it's a state site. You can make an appointment and then call 211 or 866-211-9966, and they will confirm your appointment and arrange for you a voucher with Uber to get to and from that appointment. If you are going to another site, then IU Health has been gracious enough to have a ride program going on for some time now. So rides are available if you need them. We want to try to reduce as many barriers as we can. The CDC does continue to update guidance. They just put out some new guidance on summer camps, and I know everybody's anxious to make plans for those. So there is new guidance. If you are planning a camp or sending children to camp, please look at that guidance. What you can do when you're fully vaccinated, and other updates continue to come out. And finally, I just have two thank yous that I want to give. Dr. Hiller from IU, they provided us, we had a partnership with them for a class of students who made phone calls to people who had appointments at the convention center to ensure that they were fully registered, that they didn't have problems, they knew where they were going. So with each call that they were made, whether they reached an individual or left a message, it truly helped our clinic. We appreciate that partnership with the class and the professor. A special thanks to the contacts and the liaisons with our department. In all, there were 1,716 calls that were reported to us, 604 reached individuals, 865 messages. But circumstances were uncovered that led us to be able to sort of fix things or do workarounds before the day of that appointment. 46 cancellations were made, and that then allowed us to open up those for other individuals. And again, just a shout out to everyone who has helped at the convention center, from the convention center staff to all the volunteers and honestly, my staff and others who have helped make that such a successful clinic. Thanks, Chuck. I'll take questions in a little bit.
Okay, let's check in with the Monroe County Commissioners and Lee Jones.
Thank you, Chuck. First of all, the county's CARES grants are coming to an end today. This is the final day that people can apply for these grants, and they are grants, not loans. And they're available to assist with COVID-related non-payroll expenses, which have not been covered through other funding sources, loans, or grants. Please go to co.monroe.in.us for further information, and also the application is available there. The Township Assistance Fund is continuing. The Board of Commissioners has worked with the County Council to develop a Township Assistance Fund for our Township trustees. With this funding, the trustees can assist county residents with basic necessities like rent and utilities. Every resident in the county does live in a township and does have a trustee. And please contact your trustee if you need help. And a contact list is available on the county website, once again, co.monroe.in.us, and it's on the Emergency Management Department's page. And that's all I have. Thank you, Chuck.
Okay, let's next check in with Allison Moore, Monroe County Emergency Management.
Good afternoon, Chuck. Thanks again for hosting us and for everyone here that's on the call. We've been doing our blood drives for over a year, and this is the first time that we've had a blood drive on the same day that we've had our press call. So I'd like to announce that we do have some spots available in our actual blood drive that's going on right now. So if you're hearing this live on Facebook or here today, we would encourage you to take one of those spots. There are 3 left for today. We have a 2:15, a 2:30, and a 7 p.m. So if that's something that you can fit into your schedule, we encourage our Monroe County residents to make that contribution of a blood donation. We do have 2 dates scheduled in May, and they are the 24th and the 27th. Of course, as I've mentioned in the past, we have those blood drives scheduled out through July, and those are on our county website at co.monroe.in.us. So you can hop on there, find a spot that works for you, and then hop over to redcross.org. Since we have been pushing out supplies and we do still have that mask mandate, I want to encourage people to make sure that they're keeping those masks clean and laundered. And I know sometimes, you're digging in your purse or you're digging in your car trying to find one, and we want to make sure that we are being healthy and taking care of ourselves as well. So I'd like to just to remind everybody that those need to be laundered often, and you can do that by washing those in the sink or just with your normal laundry. And also, if you do need additional supplies, we do still have those masks. Way back in February, March, I think last year, we started handing those out at all of our trustees' offices and at all of our fire departments. And just this week, I made contact with all of them just to assure that they still have supplies readily available. And so those lists are on our county website under the emergency management page. And if you are in fact in need of additional supplies, you can make an appointment at any of those spots or by calling our office at 812-349-2546. That's all I have, Chuck. Thank you so much.
Okay, let's next go to IU Health, check in with Brian Shockney.
Good afternoon, everyone. Great day here in Bloomington. Over the past couple of weeks, our numbers of COVID-19 inpatients have remained stable. As the mayor was saying, we've not seen any worsening, but we've not seen any improvement either. You see our South Central region data here, and then we have the Monroe County data that includes IU Health Bloomington as well as Monroe Hospital. And the data depicts the same trend, a steady pace of COVID-19 positives and inpatients in our facilities. Our Bedford and Paoli hospitals also continue to see COVID positive patients. They have had a census in their hospitals ongoing for the past 2 weeks, which is highly unusual over this past several months. So we are concerned about those continued infected cases, and these individuals, as we've talked about before, are the younger populations, as we've seen our older populations being vaccinated at high rates. As of Wednesday, our IU Health ICUs are 77% occupied across the state. Here in the region, they're 64% occupied. And as of yesterday, we have vaccinated over 77,000 individuals here in between our IU Health and our Paoli sites, and have used 95% of the vaccine that we have on hand. Last week, we shared a breakdown of those individuals that have received the first dose by age, and recognizing the hard work of our community, ensuring our younger populations get vaccinated. It is important we continue this focus and this fight against COVID, as here in Monroe County, we need to ensure that we're getting the word out, but also to our friends, our neighbors, and our relatives across the region. So last week, I also shared we'd be transitioning our clinic in May and June and to the IU Simon Scott Assembly Hall, and that will occur. Our first vaccine will be May 14th, and then mid-June we'll give our last second dose. This allows us to be able to start moving more into the community to give vaccines at different sites, specifically as we are hopefully expecting the FDA to lower the age of those who can get vaccines. Once that occurs and we go below 16 years of age, it opens up the opportunity for us to vaccinate more individuals, and we can do that in those outreach sites, schools, and other locations, as well as bring them to our vaccine sites. So we will increase the number, and we continue to increase the availability and number of slots open in our community and in our county for vaccines. We're now moving those to outreach and being able to do that in a different way to get more shots in arms. We would encourage you to go to Simon Scott Assembly Hall and get your shot and take your shot. It's a great place, beautiful setup, very, very efficient, very effective. And if you have not been there, this is your opportunity to do so. Last Friday, the CDC and the U.S. Food and Drug Administration both recommended that J&J COVID-19 vaccine come back on resume giving the vaccine. The pause of the J&J vaccine was just showing that we do take safety seriously around the vaccines and around the follow-up with these vaccines as well. So we have, across IU Health, across the state of Indiana, began re-administering the vaccine, and today actually being given at the Indianapolis Motor Speedway. We have several of our team members who are there on site at the Speedway from the South Central region who are giving those vaccines as we speak. We also have those available at our retail pharmacy here in Bloomington. We continue to ensure those at high risk receive the information and all the follow-up that they require if they are in that risk age group, so that we're careful with anyone who receives that J&J vaccine. But as Penny said earlier, the rate of complications or even getting a DVT or thrombosis is below 1 in a million. So we just make sure we follow up, and the vaccine is very safe. But we appreciate our FDA being overly precautious and taking the precautions and now putting it back on the list of vaccines that we can give. Remember that the best COVID-19 vaccine is the one you can get. And I will take questions at the end.
Okay, let's check in with Kirk White at Indiana University.
Well, good afternoon, everybody. Starting with the numbers, as Director Caudill mentioned earlier, we're staying pretty steady on the campus as well. So our prevalence rate this past week was level at 0.3. And really, as we look across different populations, we've seen either decreases in mitigation testing prevalence or pretty much the same as the week before. We've last week completed 18,000 individuals were tested, and this week we're up to 11,000 already. we'll have, as the week concludes, that number will get back up. But I will say that you might see a decreasing trend in the number of people tested on the campus because we're now exempting those who have been vaccinated from regular weekly mitigation testing. So this is another good way and an incentive that really, with following CDC guidance, you don't need to be tested as regularly if you've been vaccinated because the risk is much, much lower. So along those lines, going over to vaccines, we're having great success at Simon Scott Assembly Hall. As of last night, we're up over 22,000 vaccines administered since March the 29th. Our open site for the public has vaccinated almost 9,000 people, and our site that was IU community focused has vaccinated over 13,000. So we're really in great shape there. We're seeing a very good second dose return rate, which has been very encouraging as well. Now let me say along vaccines again. Simon Scott Assembly Hall is running well, as Brian mentioned. It's a great partnership between our county health department and Bloomington Hospital IU Health and the South Central region. We really want that to be a regional site, and next week we have 3,100 openings for vaccines. So go on to the vaccine ourshot.in.gov site or dial 211, get yourself an appointment and come on over. We've got plenty of supply and plenty of openings, and we'll be happy to have you. In particular, I'd encourage those in that 16 and over population to get vaccinated as soon as they can. I was reading today about some plans for a prom over at Edgewood. And as these end of the school year events occur with high school commencements and so on, now's a perfect time to get vaccinated beforehand so that you can enjoy those events in a safe manner and protect your family and your fellow classmates as well. So we do have openings on the weekends as well. So for example, tomorrow we're open from 9 a.m. until 3 p.m. at Assembly Hall. So there's plenty of time either during the work week or on the weekends to come on over and visit. We're very encouraged about where we are. This is the last week of regular classes. Next week is finals week. Commencement is the 7th and 8th. We're going to have a great ceremony, even though it's limited to in-person attendance by those just graduating. Already we have over 1,200 graduates that are planning to attend, that are graduate students, and almost 4,500 undergraduates are planning to attend the ceremony at Memorial Stadium on the 7th and 8th. So an early congratulations. We look forward to those plans continuing. I think today's the last day to sign up because you do need mitigation testing before you come to the ceremonies, and we have to get that documented, get you scheduled and documented before you get your ticket to come to commencement. So thank you very much. I'm looking forward to questions.
Okay, first question comes from Dave Askins, the B Square Beacon, for Commissioner Jones and Mayor Hamilton. He says it sure seems like the American Rescue Funds, CARE Act, could be used to pay for people to get vaccinated. Has any consideration been given to this idea?
Yeah, we haven't actually been looking at that in the county at all. We have decided pretty much against incentives. So while we're certainly looking at the American Rescue Plan money with very great interest, and it's going to be extremely helpful in all sorts of areas, that's not a way that we're planning to use it right now.
We thank you for the question. I'm not sure. We don't know the regulations yet that will specify what can be used how out of the rescue plan. We have chosen at the city to implement an incentive plan with our workforce, as I've mentioned here. We're actually looking at whether we might enhance that some, because I think we do view incentives to encourage vaccinations as a really important signal on how important these are with a wellness benefit. I guess I think in this platform, I would strongly encourage employers or other institutions that have large numbers of people affiliated with you to really consider how do you incentivize folks to get vaccinations. I know these are tricky, but it's absolutely essential that we keep those numbers going up. And as we learned, I don't think it was mentioned today, but Indiana is in the not doing well overall. We've got a long way to go, and continuing to encourage and outreach is of course important. I personally, it's incredibly encouraging to hear from the CDC now that I'm vaccinated plus 2 weeks that I can do some things that I wasn't able to do safely, and it feels great. It's so powerful to be with people fully vaccinated again in those protocols that we can do. So that's important. But I do encourage institutions to look at those encouragements and using the rescue plan money for overall resident incentives fiscally. I'm not sure whether that's allowed. We don't know yet. And I don't know whether it would be effective, but I do think institution by institution, we really ought to explore that. And I hope folks will from all the system. I know people are thinking about it, and I think that's really helpful. Thank you.
Hey, Chuck, I think we should just remind everybody that the vaccine is free.
Yes.
The government has paid for the actual vaccine. The administration costs are either handled by the federal government or your insurance. If you don't have insurance, the government picks it up. So nobody gets charged for coming. Come on over and enjoy the feeling of freedom for free.
So next question from David Wolf-Bender at the IDS for Penny Caudle and or Brian Shockney. Last week, we discussed how the state was asking sites to move to a walk-in model, so no appointment would be necessary to get appointments. Did sites in Monroe County move to this model this week? What have you been hearing from various sites regarding the walk-in model?
Certainly, it's a good question. Appointments are still obviously ideal because that allows for best planning. We have been taking walk-ins at the other sites, and I'll let them talk about that more directly. I think even across the state, a lot of the other county health departments, the numbers of walk-ins so far have been small, but we're glad to take them. And again, it's about reducing the barriers. And IU has been working on how we can let people know when it's open for walk-ins. There are just some logistical things we talked about last time about making that work efficiently for everyone. But yes, they are taking them. And then I will let Brian and Kirk talk more about their specific experience.
Yes, walk-ins are happening all across the state. As Penny said, the uptake is not as strong as we had hoped. Even the mass vaccinations by the state are walk-ins now. They're not requiring appointments, and they're just putting shots in arms. We did quickly pivot on our process by which we can get the vaccine thawed and ready for our team. We're actually looking 2 hours prior to our ending time at our clinic site to stop walk-ins at that point and take no more walk-ins at that point so we don't waste any vaccine. But all the time from big opening all the way to that 2 hour period before we close the vaccine site, walk-ins are most welcome.
Yeah, Chuck, and we're taking walk-ins at Assembly Hall 1 hour after opening. And we, again, as Brian mentioned, we need to stop 2 hours before. And that's really because we're trying to conserve the vaccine supply. Remember, this is a sensitive pharmaceutical that needs to be prepared ahead of time, and we've got to use it all. We can't just put it back on the shelf and use it the next day. We've got to use it all that day. And so we still heavily encourage those appointments. because it allows us to plan for how much vaccine to prepare so we don't have any wastage.
So a question from Mitch Legan at WTIU. This will go to Penny. Is there a time set for the clinic on 5, and has a location been set or chosen for these Spanish language focused clinics on May 10th and June 7th? Or is that June 7th, 6-7?
So yes, on May 6th, that is at the Boys and Girls Club. It's 12:30 to 5:30. The Latinx and Hispanic clinic will be at the Convention Center, and that will be Moderna. And so the first appointment, so I just lost my train of thought on the date.
May 10th. May 10th.
May 10th, thank you. May 10th, and so that it will be starting at noon, and then the second dose appointment will be in June.
Okay, and that's the 6-7 date.
Yes.
Is that right? Okay.
Yes.
Okay, happy to take some more questions here. Not seeing a new one coming up, but we've got a few minutes here, left here, so we'll be glad to do that. I'll throw in the regular IU plug. If you have questions about what's happening with the IU vaccinations, particularly with commencement coming up, you can go to covid.iu.edu. If you have students who are graduating, make sure that they get those vaccinations, or they get those tests scheduled if they're not already fully vaccinated. And then Kirk put up the website c19waitlist.iu.edu. Kirk, you want to explain what that one is?
Well, yes. Again, we do encourage those appointments, and so in an effort as best we can to make sure that we use all the supply at the end of the day, you can sign up for the wait list at the end of the day, and that's the website to get to that. So we'd encourage you to do that as well. Make sure you've got a spot. Really, it's we talked about access, and we've designed the assembly hall site to make it as easy as possible. Remember that it's on the Bloomington Transit bus lines, and as was mentioned earlier, you can get vouchers for transportation if you need that. So we want to reach out to the region to help everybody get vaccinated.
This next question from David Wolfbender at the IDS, again for Kirk. Did I hear correctly that there are 3,100 vaccination appointments open for next week at IU's site? He's wanting to verify that. And also, will IU's site continue to vaccinate the community throughout the summer and into the start of next school year?
Yeah, that is correct. I just checked the numbers, and we do have 3,100 openings for next week. Those are the hours that we have posted. Again, those are wide open that you can get an appointment at the website or call in 211. And yes, we'll be continuing on through the summer as a regional resource. And frankly, we want to make sure that we're positioned for whatever the pandemic may bring to us. And that means if we're going to need to vaccinate students as they return, or what may happen in the coming year with the discussion about possible boosters and this type of thing. So the lessons learned that we've had in putting together the good clinics with the county and with the hospital, we're going to continue to do that for the foreseeable future.
Okay. I'll wait here a moment for another question. Here's Mitch Legan with one. Does IU Health plan on requiring vaccines for employees, and what's the vaccination rate for employees if that's available? Brian?
Yeah, so IU Health employees, as we've said before, the data is hard to get from the system, but we've run some, we got some data analysts who have been working on the state database with IHI, which is the Health and Information Exchange, and we know we're well above 70% of our IU Health team members who are vaccinated that we can account for. Now, we know that there are others that are vaccinated in other locations. As far as requiring the vaccine, we have not decided to do that at this point. We're waiting for additional time for all of our team members to get vaccinated. Remember, we have a lot of team members who are working from home since the pandemic began, and they've continued to work from home. And we've evaluated that work to know that some of them can do that work at home without having to come to an office setting. So they were on the lower priority list for getting the vaccine and opening slots for the vaccine. So they're now getting their vaccines. So we're still in the process of getting everyone vaccinated.
Okay. Still have a cut. Yeah, Mayor Hamilton, go ahead.
Well, I was just going to say that, that's great getting to 70%. That's a really powerful number and a good model for folks. I do want to just emphasize, and I'm not the expert on this, but with the new CDC guidance, getting vaccines, of course, is important for your own health. It really changes what you can do socially now. I mean, I just have to say, the ability to go and have dinner with friends who are all fully vaccinated and 2 weeks out is great and important. The ability to be in places together, again, not in large gatherings, but in small gatherings. It's a human thing, and it won't happen until we get vaccinated. It shouldn't happen until we get vaccinated. And similarly at workplaces, we're going to have to be managing people differently depending upon whether you've got everybody vaccinated or not. And it's just so important to get that number way up. And it is so valuable to you individually and to your ability to do things that you've been wanting to do. So I just hope, and thank you, Brian, for sharing that number. That's encouraging. These are healthcare workers, and they're particularly sensitive to the importance of it, which is great, and a model for the rest of us. But whether it's school systems or public employment or large private employers, it really makes a difference, not only to putting the pandemic back away where we want it to go, but also in the ability of yourself to just do things that you've been waiting to do. So anyway, enough for me, but I just wanted to share that. It really, how important that is.
Oh, those are important words, and it is important. And I will note once again, as I did last week, you get a sticker if you get the vaccination. So, I mean, if that's an incentive there. I mean, it's worked for me since I was about 5. So, enough for me.
Chuck, I'll add something to that. We're looking for different incentives on the campus as well. And our Assistant Dean of Students for Fraternity and Sorority Affairs, Leslie Fasson, will be at the clock by Woodburn Hall today at 3 o'clock to pass out cookies and stickers to those students who have been vaccinated. It's just a fun thing to do on a sunny afternoon, and it gives a chance for the students and our Dean of Students Office staff as well to interact a bit in an outside safe environment and have a little fun at the same time.
All right. Yeah, see, I didn't get a cookie. I may have to go down there and show my sticker.
You need to get over there. Yeah.
All right. Well, we're going to leave it there. We will be back next week to talk about the developments with COVID-19 then. Thanks, everybody, for your questions and your attendance, and we will see you then.
Thanks, Chuck.
Thanks, everyone.